Welcome back. Your time now 5:27, and from trauma wounds to diabetic foot ulcers, chronic wounds, if left untreated, can lead to amputations and even life-threatening infections. In this morning's Health Matters report, we have the story of one man who's thankful he got to the hospital before it was too late.
88 heart rate, 97.
With a check of the blood pressure and a look at the temperature.
Are you having any pain in that wound?
Doctors and nurses here at Baptist Health in North Little Rock now get to work on the reason Jerry Dearden is sitting in this chair.
That looks really good.
It's been quite the journey to get to this point. It all started when Dearden fell down a levee while working in Nebraska.
I was about 15 or 20 feet down, and I hit my knee. At first, it swelled up like a cantaloupe.
It just continued to get worse. At 86 and a diabetic, he knew he needed to come back to Arkansas and get to the hospital.
I was at the risk of losing a leg or a life.
He had an infection, which landed him in the ICU.
Jerry's wound was pretty bad.
Doctors knocked out that infection, got the wound cleaned up, then sent him over to wound care physician Dr. Landon Humphrey.
We have kind of worked for the last several weeks to kind of get it to heal the rest of the way and close because he lost a significant amount of tissue.
They have several ways to do that, including different dressings for the wound. Some have silver, different chemicals.
All the way up to what we're using in him, which is a biologic dressing. In his case, it's kind of like a skin graft that we can use to help cover the wound and help promote growth.
In just a few weeks, Dearden has made quite the progress.
As ugly as it is, I'm proud of it. It really looks good.
And is looking forward to the day he leaves this hospital for the last time and gets back out on the job.
He'll release me one of these days. He knows his goal is to get me back to work.
The Wound Care Clinic at Baptist Health in North Little Rock treats all kinds of chronic wounds, from traumas, diabetic foot ulcers, pressure ulcers, and post-surgery wounds. Dr. Humphrey says if you have a wound, it is crucial to get to the doctor as soon as possible. If you wait, you have more of a chance of infection and a longer healing process. We'll be right back after the break.